Welcome to AT&T's teleconference service. Please enter your access code, followed by the pound sign. To join the conference as the host, press star. Otherwise, press pound. Please enter your host password, followed by the pound sign. There are 2 participants on the call, including you. You're joining your conference as the host. For a menu of available commands, press star pound.
Hi, Marie Kerr. I'm online.
Steve, it's Barbara. Can you hear me?
Loud and clear.
Hello? Oh, he said yes. Oh.
Yes, I can hear you.
All right. Okay, we're going to be maybe 3 or 4 minutes. For some reason, my iPad won't connect, and we're trying to see if we can get a quick fix on it. Almost evening. It's really hot out there. You're a miracle worker.
Get up with your button. Marie Kerr, I'm on the line.
Thank you, Marie.
Thank you. Marie, we're going to be 2 or 3 minutes. We're trying to see if we can get my iPad linked up with the website.
Okay.
All right, Steve, I think we're about as ready as we're going to be. How are you up north there?
We are ready to go.
Okay. I can see what everyone suffers with down here on not being able to hear you very well. Can you get the mic a little bit closer or see if we can get the volume up just a tiny bit?
Can you hear me better?
I can. It sounds like you're talking through cotton, though. It's kind of muffled.
Okay,
Anyway,
I'm as close to the microphone as I can get.
Okay.
So we'll see about being able to turn it up.
Yeah, that's a little bit better. We've got some fans going here, too, which I think maybe contributes to it a little bit. Anyway, I believe that we have Ms. Kerr on the phone line, so it looks like we have a quorum. I'm going to go ahead and call this meeting to order. This is a properly noticed meeting for the Silver State Health Insurance Exchange that's been scheduled for today, May 8th, in Carson City and in Henderson. I don't have any particular announcements today. I'll ask staff, Mr. Fisher or Ms. DeRusse, whether or not we have any announcements. Okay. Mr. Fisher, do you want to take roll call and see if we have a quorum, please?
Sure, Madam Chair. Ms. Johnstone?
Here in Henderson.
Ms. Lewis?
Here in Henderson.
Dr. Jameson?
Here in Henderson.
Ms. Kerr?
On the phone?
Dr. Ford? Mr. Wilden?
Present in Carson City.
Mr. Rich sitting in for Mr. Kipper?
Here in Carson City.
Ms. Teska? Vice Chair Atkins? Vice Chair Atkins?
Here.
And Madam Chair Campbell?
Here.
Madam Chair, you have a quorum.
Thank you, Mr. Fisher. We'll move along to public comment. Can we have a show of hands for public comment in Carson City and here in Henderson? All right, we have 2 persons here in Henderson. How many do we have there in Carson?
Madam Chair, we have 1 in Carson City.
Okay. Let's alternate back and forth. So we'll start here in Henderson. Whoever would like to go first, if you would come forward, please, and identify yourself for the record.
No Wheaties this morning, I guess. Madam Chair and board members, I am Ted DeCourt with CARE, one of the Navigator organizations. I submitted testimony online and it is posted, but I realized that it was fairly late in its posting, and so some of you may have not read what we had written in terms of the assessment that was presented by Deloitte. And in that particular assessment, we basically have 3 options. Option number 1, which of course is to join the federal exchange, and that is something that we are adamantly opposed to for a variety of reasons. One, of course, is the delay it would take to become part of the federal exchange, which would be up to 1.5 years to 2 years. I know we've had dialogue with federal exchange members in terms of how long it has taken the various states to go in that direction. The other 2 options that we, of course, see as the most viable is one is the replacement of the current vendor, Xerox, and replacing them with another vendor of the choosing of the board. And third, of course, is to use remedial type of prevention to work with Xerox and go forward. Our position is that we believe that extensive time and money has been expended, and that remedial remedies using Xerox, increasing the members of the exchange staff, is to us the best remedy. As I have outlined, We have no idea what it's like to start from scratch. We've already done that one time several years ago. And we have no idea that by starting from scratch again, we will be ready either for, in fact, we will not be ready for the upcoming open enrollment. And most likely will not be up in the same position we are today for the subsequent open enrollments. So that is in summary, basically what I had posted. We believe that a reconciliation is needed, a rapprochement with all of the partners, the carriers, the exchange board, the exchange staff, the navigators, and Xerox so that we can proceed and move forward. This is not to be light of all of the laundry list of things that we have had and the problems with Xerox, but we know Xerox and we have gone a long ways in terms of remedying and fortifying the customer service and the exchange, and we believe that moving forward with Xerox is the best option. Thank you.
All right, public comment in Carson City, please.
For the record, Art Remp, REMPP. Can you hear me okay?
It's a little light. If you remember to stay close to the microphone, it'll be helpful.
Okay. Madam Chair, Vice Chair, board members, first I wish to acknowledge the long hours and work being done by the carriers, board members, the SHIX staff, and the Xerox State Healthcare LLC staff. Thank you. We are all trying to make this work. While there have been some improvements, I feel it's necessary to share some challenges that significantly impede our ability as a carrier to maintain operations and provide the quality service we feel our health plan members deserve. I think I failed to recognize them with St. Mary's Health Plans. First, electronic data interchange file status since April 1st. From Tuesday, April 1st until Tuesday, April 8th, St. Mary's Health Plans held on receiving any EDI files, the 834 enrollment or 820 payment files, due to incorrect effective dates being sent for members. The issue was resolved by April 9th. But obviously we didn't receive the files because we didn't want to have incorrect data in our system. Then from Wednesday, April 9th until Tuesday, April 29th, 15 working days, EDI files were sent on a pretty consistent basis, with only 3 days having no files. Then between Tuesday, April 29th and today, Thursday, May 8th, we have not received any electronic data interchange files, that the 834 enrollment, 820 payment, or EFT deposits. When there are no EDI 834 enrollment files, we as a health plan are unable to enroll new members, answer questions a new member may have regarding coverage, because we don't have confirmation of the plan selected, and we can't see changes that have occurred on existing membership. It could be said that the information does come within a few days, and that's fine, unless it's you or your family member is the one that's looking for the information. This makes our health plan appear inept when we can't answer those questions. Next, variance reports. 820 payment file reconciliation with the actual EFT, electronic fund transfer, the deposits made in the bank. In summary, the process in place for Xerox to generate and send files to the carriers is that, as an example, on day one, the 834 enrollment and 820 payment file is generated. The Xerox team reviews the files and then releases them to the carriers within about 2 days, and then an EFT deposit is processed. The EFT deposit doesn't always match the 820 payment file. Within a day or two, a variance report is sent to the carriers that explains the differences between the 820 payment file, what should be paid, and the EFT deposit, what was actually paid. For several months, we have asked for a detailed report of the EFT deposit, and it hasn't or can't be produced. The reason for the variance has to do with the advanced premium tax credit, the APTC changes, and has been explained to be, but frankly, it doesn't make any sense. My thought would be to correct the 820 payment file prior to sending to the carriers, then make the correct EFT deposit, which seems it would like it would improve the process. Next, on terminations. To date, St. Mary's Health Plans has only received 4 termination spreadsheets or emails. One of the termination emails was confirmation of a list of duplicates that should be terminated. We have concern that we have active members that should be terminated either due to non-payment or a self-term. Providers call us to ask eligibility of members, and we are unable to confidently provide this information. This puts providers and us as a health plan at financial risk. Next, ineligible Medicare enrollment through an exchange plan. You may have heard of the challenge with the Medicare members. There isn't a mechanism in place to filter Medicare age or Medicare enrolled individuals during the exchange application process. As a result, there's a high number of members for all carriers where this is an issue. Xerox requested 2 weeks to develop a plan. That time has elapsed, and we're waiting for an update. We're waiting for further steps from Xerox on how to resolve. And finally, we feel helpless as a carrier because we are so dependent upon the Xerox process to deliver accurate information. The St. Mary's Member Services Department is getting calls from members with issues who report that the exchange call center says that the health plan has the information, and if there's an error, the health plan has to fix it. This could be the issue, but a majority of the time, the issue resolution requires intervention from Xerox to fix the plan, effective date, etc., things that the carrier cannot change. Our organization has a dedicated team of staff with full-time responsibilities elsewhere that are now spending full time working on exchange issues. This was not factored into our operating plan or budget. I work closely with these individuals on a daily basis and am clearly aware of the long list of growing issues and problems with the exchange member eligibility and payment files. Our team submits daily questions and issues to the Xerox team. To date, only few have been resolved. We know that we have several hundred members caught in the myriad of issues that are not being addressed or resolved by Xerox, and these issues are severely impacting our operations and ability to provide quality service to these members. As these issues continue, our vendors and providers are and will be negatively impacted, as well with payment issues, refund issues, and confusion. Our reputation as a quality health insurance company is being tarnished and is of a great concern to our organization. Xerox must find solutions immediately, as we cannot tolerate the lack of resolution and lack of urgency any longer. Thank you.
Before you leave, I wanted to ask a question, just point of clarification in your testimony, please.
Yes, Madam Chair.
Am I clear that you have not received an EDI file since April 29th?
Art Ramp, for the record. Yes, Madam Chair, that's correct. We received an email this morning that the issues have been resolved, and we should be receiving a file either later today or tomorrow to catch us up.
I know that you talk with the other carriers. Is this something that's unique to you as a carrier, or is this across all four of the carriers?
It's across all carriers, as far as I understand.
So it's been almost 2 weeks since you've had an EDI filed.
That's correct, since the 29th of April.
Thank you.
Thank you.
Could you identify yourself for the record, please?
Thank you, Madam Chair, members of the board. My name is T.B. Ellis. I'm the CEO for CARE. But I am also a member of the advisory committee for this exchange. I have been part of this process since October 11, when you guys started your first meeting as a board for this project, which then became all of our mission. In February 2012, the advisory committees were formed, and I started my work hands-on to help form and implement this strategy, focusing on what we wanted to do, increase the number of uninsured Nevadans. And on 2012, August of that year, we were introduced to Xerox as a vendor, as a possible vendor. And we asked the question in our subcommittee as well as on the board, why Xerox? And we were told that it was one of the vendors who didn't have the overwhelming responsibility of serving other states, because this was a nationwide project. And many states were faced with the same issues that we were facing, finding a vendor that could help us go live October 1st. So we picked Xerox as one of the vendors that we knew that it was not going to be challenged with having priorities between Nevada or Florida or any other state who chose to have an state exchange at that time. In less than 12 months from the time that contract was presented and then later on approved, we were trained to use the program, to go into trying to learn how to enroll people in the exchange so that we were opening the doors in less than 60 days. So within those 12 months, our vendor had to create a program, test the program, implement the program, connect with the federal hubs, and have it ready for us less than 12 months after for all of us to be trained, brokers, agents, navigators, and enrollment assisters alike, as well as the staff. The reason I'm sharing this with you is because I don't think in a project this large 12 months was enough. So therefore, we went live with a system that was not ready. And we have experienced throughout the months many issues that we continue to experience at some point. But many things have been resolved, and many things are in the process of being resolved. So we have a vendor that had responded, increased staff, and also increased their response to our needs, even outside of their contract responsibilities, because they became part of our team. Is it the way that we want it today? No. Would it be the way we want it coming October 15 for the next open enrollment? We hope so. But we can only do that if we continue to work with a vendor that we know that is in place and we are trained on. Option number 2 of finding another vendor is not an option in our view, because there is no vendor out there in any of the state insurance exchanges that is going without any issues, including the federal hub, including the federal vendor. So it's not like we can pick from an agenda or a group of vendors that we can say, hey, the vendor for Oregon is doing perfect. Why don't we go with them? That doesn't exist. We don't have a choice. And going to the feds is not a choice for Nevada. We would have to wait until the legislative session goes on in January, wait until they get approved and ratified by the governor. By that time, open enrollment is closed, and then we need to wait for the federal exchange, for the federal hub to absorb us or transition us to them. By that, we may or may not be ready for open enrollment in 2015. So you are in a very difficult position, picking between what do we do today? What do we do today to continue to serve Nevadans, which is our mission, to continue to increase the number of uninsured, to serve small business owners who are looking to insure their employees, and what do we do coming October 15? And it is a very difficult decision, especially in the face of everything that continues to happen and the challenges that we continue to have. But I want to remind you that as me, starting in October of 2011, we're here to serve Nevadans. And Nevadans are trained to go into the Nevada Health Link now and open their accounts to either re-enroll or seek insurance. Not a new system, not a different system, is what we have now. Hopefully better. And all the people that are enrolling right now, all the enrollment assisters and brokers and agents, the thousands of them who are trained like me, are now used to this system. And we just hope that it improves. We hope that they retrained us with the better features that they need to upgrade the system and improve the system. But going to something very new, it's very difficult in the middle of this project when we haven't even had 24 months of going live. So I will ask you to really consider all the options, look for all the facts, look for all the risks, ask a lot of questions before you make a decision, and no matter what decision you make, you know that we are your partners.
Thank you, Ms. Ellis. Do we have any other public comment in Carson City?
No, Madam Chair.
Any other public comment here in Henderson? Okay. Oh, we do.
Madam Chair, members of the board, my name is Andres Ramirez. I'm with Ramirez Group. We are one of the navigator entities with the Silver State Health Insurance Exchange. I think it's fair to say for everybody in the room, it's been a rough first period of this enrollment exchange. Certainly have been a problem with the website. Any problem of this nature as a computer science student was going to have problems. Anytime Apple unveils a massive new software upgrade, there are glitches and problems. When Google updates a massive Android problem, there are glitches and problems. Any software system of this magnitude is going to produce that. So we went into this very well. As a matter of fact, one of our fearless leaders, Shauna, told us early on, hey, Andres, we expect there might be glitches, so we really don't want you to go full force for the first week, maybe wait a few days to see what happens, because these things happen. I said, great, because that's what we're planning, because this is just what happens, and we want to make sure once the light switch goes on, we're able to adapt and not have thousands of people outside our door on day one and not be able to process them. I say that just because I want to make sure we're clear that I don't think there's anybody here or in the state who should have expected a glitch-free system. The issue to me is not whether we had glitches, but what systems were put in place by this board and by the vendor Xerox to resolve the glitches and the errors that were inevitably going to come up, how to resolve them in a prompt manner, and how to enable us as navigators and functionaries of the state to continue to do our job that you guys ask us to do, to enroll people. And I think that's where we have kind of failed at this process. We keep looking for reasons to have to blame or who to point the finger to for what went wrong. The system went wrong. Everybody's aware of that. Everybody can agree to it. I don't think we've been very focused on how to fix the system to move forward. And I think that has complicated efforts for Xerox. That has complicated efforts for us as a navigator. I've watched these board meetings. I've listened to minutes. I've talked to people at Xerox. And there kind of seems to be this fractured sense of what we need to be focusing on and how to shift these things, as opposed to resolving the situations as best as possible. And what I'd like to see happen, as opposed to us continuing to stay in limbo about whether we switch to one plan or another, and I disagree slightly with my colleagues. I think there were some states that had a system that went off much more significantly and so forth. But the issue for me is not whether we're still evaluating this, but let's be confident in who we're going to. If it's going to be Xerox, let's give them the confidence that we're sticking with them so they can focus on fixing these systems. And we as navigators know what we're going to work with. And the people of Nevada who've already been enrolled know what system they're going to have to work with. If we're going to switch, that needs to happen. All of us are going to have to be retrained. There's now approximately 200,000 Nevadans that have an account that are going to be need to be ported over to whatever this new system is if we choose to have it, and expect that that goes glitch-free before lifetime of re-enrollment, and then still be able to take on the task, us as navigators, of having to enroll the next group of people that you guys want us to enroll during phase 2 of enrollment. So there's a lot to think about this, other than just what went wrong, and who do we blame for this. On a practical level, there's a lot of things that we as navigators have had to do that I don't think were anticipated in our original job descriptions. My company itself, we've talked about, I had to add an additional 20 phone lines because people were calling us, asking for help because they couldn't get through the Xerox helpline, and they were just calling anybody for help. We couldn't manage the call system with the existing call system, so we had to expand ourselves. We had to expand hours. We had to expand shifts. We're all looking to figure out how we best serve the consumer and give them the service they need. Part of that is establishing better cooperation between us and Xerox, and the systems that, we discussed this at one of our board meetings, that navigators need to have better control of the system itself so that we're not creating a bottleneck and dumping everything on Xerox as we have now. Most problems that we have to call Xerox. We have to go through a hotline. We have to go through an email. We have to do a lot of variety of things that create system inefficiencies, whereas we who are already trained ourselves, we've gone through background checks, we've been assigned to help enroll people, don't have all the freedoms to be able to do this. So when we're looking at the systems moving forward, and we're looking at our options moving forward, and we're looking at what updates need to be doing, I prefer that we stick with Xerox since we've already trained on that, but that we're building these upgrades so that it makes it easier for us who've been assigned by you as a board to do our job so that we can do our job more effectively and efficiently and take some of that duties off of Xerox, which I think are creating a lot of bottlenecks in this process. That's my statement. Thank you for giving me the time.
Thank you, Mr. Ramirez. Do we have anyone else here in Henderson for comment? All right. And I don't think there's anyone else in Carson City. Is that correct, Mr. Fisher?
That is correct, Madam Chair.
All right, thank you. We'll close public comment for now, and we will have public comment again right before we adjourn the meeting. Let's move on to agenda item number 3 for the approval of the minutes. Let's start with March 20th, 2014. Are there any additions, edits, or amendments to those minutes?
Madam Chair, when it comes, no, I think the language has been altered from the last board meeting. So the new language is there, and other.
All right. Do you want to move to approve then?
Sure. We approve the March 20th minutes.
I second movement
Okay.
of the March 20th minutes.
All right. Thank you, Dr. Jamison. All right. All in favor of the motion for the March 20th minutes?
Aye.
Any opposed? Thank you. The motion passes. How about the minutes from April 10th? Any changes or edits to those minutes?
Presented.
Florence Jamison, I second it.
All right. Thank you. All those in favor of the motion to approve the April 10th minutes?
Aye.
Any opposed? Thank you. Motion passes. And then lastly, the minutes from April 17th.
Lynn Atkins, so moved. We accept as presented.
Is there a second?
Levon Lewis, second the motion.
Thank you, Ms. Lewis. All those in favor of the motion?
Aye.
Any opposed? Motion passes. Thank you very much. Let's move on to staff's discussion regarding the options of the analysis for the exchange. And Mr. Fisher, are you going to conduct that discussion for us?
Sure. Thank you, Madam Chair, board members. For the record, Steve Fisher. And I just wanted to update the board on the status of the analysis of the 3 options. Staff are currently working on the analysis of the options, the following options. Obviously, one option is to remediate the current system. And within that option, we would also hire additional staff to augment the exchange staff. And another option would also be for the board to consider would be hiring a vendor to perform project oversight of Xerox for that particular option. The next option under analysis is to transfer a system from another state, a system that is working in another state, and hire a vendor to implement that system here in the state of Nevada. And the final option is to go to the federal facilitated marketplace. And so those are the 3 options that are under analysis. Next week, we will be meeting with our federal partners. We will be going over these options with our federal partners. And so I'm here today to ask the board for an additional 2 weeks. I understand that this is, time is of the essence. We need to get this done as quickly as possible. But I also know that the staff want to be able to provide the board with the best possible information to make an informed decision. And so I'm asking the board for your permission to take an additional 2 weeks to provide this information to you. And with that, I would open it up for any questions you might have.
Do we have any questions for board members to Mr. Fisher?
Madam Chair, Leslie Johnstone. Mr. Fisher, on the second option about looking at another state's exchange, I assume that's any working state exchange not limited to Deloitte's system?
For the record, Steve Fisher, yes, that would be any other working state system.
Any other questions? Ms. Atkins?
Mr. Fisher, I'm sorry, when is it that you're going to be meeting with the federal partners?
We are flying back to DC next, I believe it's next Thursday. We will be meeting with them all day Thursday next week.
And so you're asking that we defer this to the 22nd? I'm sorry. Oh, the 23rd? Yeah, I guess when you're talking 2 weeks, you're talking exactly 2 weeks, and is there a way we could, I think when would be the earliest date possible after everyone returns from DC to have a report? I just think, as we all know, time is not on our side, and I think every day we kind of push it back, we lose, and so I'm just wondering when's the earliest possible date we could have some report?
Thank you for the question. I'm asking for the 23rd. However, if we have all of the information and the report completed, certainly we can do it sooner than the 23rd.
Any other questions? All right, Mr. Fisher, I just want to make sure that if staff comes up with any other options that would be feasible for the board to look at, that you're including that you're not restricting it just to the 3 options that were in the assessment. Is that a correct statement?
Yes, Madam Chair, for the record, Steve Fisher. Yes, another option would be, scrap the current system and build a system from the ground up. That could be another option that the staff would present as part of another option.
I'm certainly not asking you to disclose what those are at this point. I know that there's a lot of analysis that needs to go on in making those recommendations to the board. I just want to make sure that you're keeping every option available that has some feasibility to it, that you'll bring that to the board.
For the record, Steve Fisher, yes, we will do that.
Yes, Ms. Johnstone?
Leslie Johnstone. Mr. Fisher, I assume this is going to happen, but I would just like to verify that you're taking advantage or will be taking advantage of all the state resources to look at all angles of each option and not the exchange staff is intimately knowledgeable about what is required, but it always helps to have different sets of eyes on a situation. So both from the technical side as well as from Health and Human Services side, so that the ramifications and considerations that you prepare for us are as comprehensive as possible.
Yes, for the record, Steve Fisher, we have included, the EATS has been in close communication with us with regards to these options, as well as the Division of Welfare and Supportive Services.
Any other questions from board members to Mr. Fisher? All right, hearing none. What I'd like to do right now is move one of the agenda items forward right now, because I think it's pertinent to this discussion that we just had under agenda item number 4, and that is discussion for possible action on dates, times, and agenda items for future meetings. I would like to request that staff poll the board members to see if May 23rd would be a good date for board members to get together to review and discuss the options that staff has put together, anticipating that we may be ready to make a decision at that point in time. But I think it's very important that we have as many members of the board present at that meeting as possible. So if I can ask Mr. Fisher and Mr. Roos to poll the board, let's tentatively look at May 23rd, which is a Friday. That should give staff a good full working week. Okay. Well, let's know that we need to be flexible in case we're not getting answers and things as quickly as possible. So if you'll go ahead and do that. And then I'm also going to ask our Attorney General if he would schedule another non-meeting for the board members with the Attorney General's office so that we can continue to discuss some of the litigation that's pending right now. And I specifically want to know from the Attorney General if we are getting responses to our requests from Xerox, and are you having phone calls from council to council returned to you? So if we can have Mr. Belcourt try and schedule that non-meeting for us, probably, I don't know if it can be tomorrow or in the next several days. I think it's important that the board keep updated on the litigation. Are there any other items? Yes.
Woman, on that Friday, 23rd, is it possible to do it from 12 later? Could you consider that?
Certainly. We'll ask staff to just kind of get a feel from the board members what time of day would be the best for them. And I think we ought to figure that this will probably be the only item on the agenda, but we probably need a couple of good hours to go through the options. And if the board is ready to make a decision, we'll need that time to deliberate.
Madam Chair.
Ms. Kerr, are you speaking? Oh, okay.
I'm speaking now.
Okay. No, it sounded like you were talking, but we couldn't tell if it was somebody out the hallway or not. So thank you. Ms. Johnstone?
Yeah, I was just going to echo what Dr. Jamison said, but we may even want to think early in the day as well. I know Dr. Ford had indicated to me at one point that it was very early in the day would be easier for her. So just ask for all times of day and see what schedules provide.
Thank you. That's a very good idea. Any other comments about future meetings? Anything else for the agenda? Anything for the non-meeting that other board members would like to have on the agenda for that? Okay. All right, then let's move on then to agenda item number 5. Discussion and possible action regarding the executive director recruitment update. Ms. Eaton?
Thank you. Carrie Eaton for the record. This report will provide the board with an update regarding the recruitment process for the executive director. Recruitment efforts to find the permanent executive director candidate started being advertised on March 11, 2014. At the April 10th board meeting, the board decided to cease the solicitation of an executive recruitment agency to take over the recruitment process, as there were no agencies that had an interest that would be able to meet the budgetary needs of the exchange. And as the initial recruitment advertisements expired, staff chose to renew some listings as well as add additional listings to broaden our recruitment in an attempt to reach additional audiences. There are 2 tables on page 2 of the report. The second table is a breakdown of what has been added or renewed for the next month to recruit for an executive director. And staff would ask the board to provide staff guidance on the future of the executive director recruitment process. Thank you.
All right, if I might, staff has asked me, or the board has asked me to coordinate this. To date, we've had 37 applicants. We've gone through a first review of the first applicants. I think that field has been narrowed down to probably 5 individuals that might be considered inviting to have an interview. Since we have expanded our advertising into San Francisco Chronicle and the Seattle Times, we have had, I think, 8 additional candidates, and I would say there are probably 3 really viable candidates in that group as well. I think, Ms. Eaton, correct me if I'm wrong, I think the advertising ends May 23rd for all of the publications.
Carrie Eaton for the record. Yes, the last publications will end on May 23rd.
Okay. And I think it's possible for us to cancel and close the application process earlier if We feel we have a good pool of candidates. Is that also correct?
I believe so, but I will look into it to ensure that's correct.
And I think Mr. Roos is telling us that we can keep it open until we actually contract with someone for employment. So I think that we're probably ready to possibly move ahead with some potential interviews. But at this point, I'd like to get another good week with the advertising in San Francisco and out of the Seattle Times. So that would be my report to the board on the recruitment process. Any questions?
Madam Chair, so should we start thinking about when we would maybe schedule those interviews and we would have them at the June regularly scheduled board meeting? Oh. So I would wonder if we would have enough time to do something like that at the June regularly scheduled board meeting. We have so much on our plate, so that's kind of what I'm thinking too. Yes, thank you all. But probably that first week in June is what, I mean, you know, again, I think sometime maybe that first week in June or first 2 weeks of June, I think would be great. But yes, I would think it should be separate.
All right. Thank you for those comments. Anything from you, Ms. Kerr?
No, thank you.
Thank you. All right.
For the record, Shauna DeRoos, just to get a little bit of guidance from the board. So as I think of interviews, what is the board's position on, because I know we'll get the question, when you invite someone to an interview, if it is long distance, are you amenable to phone interviews as an initial interview? Are you looking at having more than one interviews and narrowing your field down? Or have we, I don't know that I've been involved in that discussion, so in order to be able to help guide this along, have we thought about that at all?
My thought process would be if we have a group of 8 potential candidates, that those probably be done by telephone and that be narrowed down to a field of 3, and those 3 be brought to the full board for a physical interview, and that those, we pay for transportation for those individuals. Does that sound appropriate? Okay. That would be my preference.
I similarly,
we can't hear you. Your mic's off.
I'd like to see that we use develop a set of questions, either half a dozen or so, and then have each candidate have the same questions and be limited to 30 minutes.
So that the board knows, I have been working with the state HR department and looking to them for guidance when I have a question on something. So I think I will rely heavily on their guidance as to the type of questions and what the format should be. So they've got a real track record in that area where the 7 of us probably do not. So, Ms. Lewis?
Well, I was just going to comment about the time. I think in terms of interviewing an executive director, we might want to have more than a half an hour for each interview. So as you're working with the State Human Resources Department, they may want to give you some guidelines along those, along that timeline.
Madam Chair, I agree that when we interview the final 3, I think they definitely would require perhaps up to an hour. I hope that screening of the 8, we wouldn't spend an hour with each one, but I certainly am flexible and would yield to your recommendation that HR, who's had that experience, give us their advice, and if half hour and preliminary screening isn't enough, then certainly.
All right, thank you for your comments and feedback. Any other comments regarding this agenda item? All right, then we'll go ahead and close item number 5. And Ms. Eaton or Mr. Haycock, who's doing the enrollment?
Madam Chair, today that will be given by Ms. Rich.
Oh, okay. Thank you, Ms. Rich.
For the record, Laura Rich, Quality Assurance Officer. I'm here to provide the board with enrollment statistics through May 3rd, 2014. And I just want to begin by addressing a couple of requests by the board. I know that there was an interest by the board to get information relating to attrition rates and also statistics relating specifically to special enrollment numbers. So first, the exchange has developed disenrollment and QHP performance reports designed to show the adoption and retention rates. These reports are currently in production, but because of system limitations and workarounds, much of the data is currently unreliable at this time. So for example, a person who encountered errors in their account after enrolling and had to start a new account, that would show up as a termination and but it wouldn't be a true termination. So we can't rely on that for the attrition rates. And also, we've been unable to narrow down the enrollment numbers to include only those that occurred during the special enrollment period. So we cannot define those special enrollment statistics. There's just too many variables right now to give a true representation of who came back to the exchange during that special enrollment period and differentiating them between other scenarios. So there's lots of variables involved, but Xerox is currently working on a method to getting these numbers. So the board should have them, I hope, by the end of the special enrollment period. So moving on, I won't go through all these numbers. We do have the report in front of us, but I just want to point out that we saw most of the activity in the months of December and March. We've slowed down quite a bit, but we still saw quite a bit of eligibility determinations during the month of April. And confirmed plan selections obviously did decrease. We didn't have as much activity on the confirmed plan selections, but we did see quite a bit of enrollments in the month of April. Xerox call center staff has been able to resolve some of the enrollment barriers and has pushed through about 8,000 enrollments in the last month. So we did see the enrollments go up to, as of May 3rd, we are up to 34,820 enrolled in a QHP, 29,770 enrolled in a standalone dental plan. The QHP enrollments by carrier haven't changed much. There was a request by dental carriers to include the breakouts of enrollments by dental carrier, so I have included that as well. The enrollments by service area, there also hasn't been a lot of change there. I did provide a breakdown of the FPL, poverty level breakdown of enrollments in QHPs. If you see that there is, under that 138%, there is a population of people that have elected to choose a QHP versus taking Medicaid, so those people had to pay full price for that QHP. And then I have provided a breakdown of the plans by, or the enrollments by metal and how many of those have APTC. The age of QHP subscribers still hovers about the same. 43.4 is the average age. I also have the race and ethnicity breakdown. And call center statistics, I did include the cumulative statistics, but I also wanted to include a snapshot of the last week, just because you can see that there is quite a bit of an improvement between the cumulative numbers and what we're seeing within the last week. And then I also wanted to include the appeals. We have had 3 Medicaid appeals processed through the exchange. We have yet to have any exchange appeals. Those have all been resolved prior to becoming an appeal. So we have not seen any appeals go through the call center. So with that, I'll take any questions.
Do any of the board members have questions for Ms. Rich on the enrollment numbers? Ms. Rich, I do have a question. You do send us this report week over week, and I noticed in the reporting last week that the enrollment numbers were relatively flat compared to the week before. And I've had some phone calls from brokers stating that some of the enrollees have not been able to make payments either on phone or on the internet. And I don't know if there's a relationship between that and the low growth in the last week. Do you know anything about that?
There could be. I don't have the answer to that question right now. I can look into it and get back to you, Madam Chair. I know that in the past we have had, that has been a barrier to enrollment, and once that has been fixed by Xerox, usually we see a big bump in enrollment numbers. So I can look into that.
Is there anyone else on staff that might be able to answer that, or are they knowledgeable of that problem?
Madam Chair, for the record, Steve Fisher. I have also received similar emails, and I have requested or made a request of Xerox to give me the status of where the payment process is. I have not received that status back yet. I did send that status out this morning and expect to get that back. Was hoping to get it back by the meeting, but have not. So anyways.
Would you mind sending that request out and then also asking them to have a response back to you no later than end of business day tomorrow?
Madam Chair, yes.
Thank you.
Madam Chair, Lynn Atkins. I would have to echo, I've probably had more complaints from carriers and brokers this past week than I've had in a long time. And it sounds to me like things are taking about 20 steps back, maybe 100 steps back. I'm not quite sure, but there is a groundswell of frustration, and I think the numbers over the last week show that as well. So there is something continually, wrong or going backwards. I don't know, but the number of complaints has just it's bad.
Any other questions or comments from board to staff?
Madam Chair?
Yes.
Mike Wilden, for the record, as has been said before, I'm also getting those significant number of complaints, and I'm wondering if we can't get a periodic report. I would actually like to see it daily on the 834, 820, EDI, whatever alphabet soup we want to use. We get it on the number of apps, E4 transactions. We can see what's going on daily, but we do not see the stats between Xerox and the carriers, and I believe we need to see it because I have seen the complaints increase this week also, and I would like to see the daily statistics.
Marie Kerr on the line. Is there a representative from Xerox present who can give us an explanation of why we're seeing an escalation of complaints recently?
Ms. Kerr, I believe we have someone that will come forward.
Thank you.
You'll identify yourself for the record, please.
For the record, this is Greg Vidiello from Xerox, and we did receive Mr. Fisher's email this morning. I responded to Mr. Fisher letting him know that we were going to try to get him a response by the end of today. I can't really comment on yet what the issue is. We are investigating it. As you said, I heard that there were new issues that have arisen in this week. We're trying to identify what those are, and so as soon as we have that, we'll respond back to you by tomorrow.
Mr. Vidiello, I am getting comments from the brokers and also copies of emails that where the call center is telling the brokers that the system just is not working for payment right now, and that enrollees have to use their bank account. And there are a lot of people that don't want to do that. So it's putting a roadblock out there. And it sounds like this isn't just in the last day or two. It sounds like it's been going on for at least 10 days. And I think our enrollment numbers are reflective of that. I mean, we can see that people are picking plans, but nobody's paying. And so I think it's something that really needs to be addressed quickly. I mean, we've only got, how many, 20 plus days left in this special enrollment period. And it's great that they pick a plan, but if they don't pay, they're not in the special enrollment. So this needs to be focused on immediately.
We will do so.
Do any of the board members have other questions?
I think this is Leslie Johnstone. Possible agenda item for our next meeting also is to talk about having someone go in and review the payment files. Between the EDI process not working and now hearing that payments are difficult for individuals to make, I think we have some due diligence that we have to do to make sure that the payments that have been received are being recognized in the accounts appropriately.
Thank you, Ms. Johnstone. And I think that's probably your third or fourth request for that to be done. So that's not a new request. That's an old request. Any other questions or comments? Ms. Kerr? And any of our other
I'd
board
actually like
members?
to see that. I'm sorry, this is Marie Kerr. I'd like to see that on every meeting that we have. I'd like a report from Xerox on that last item by Ms. Johnstone prior to our meeting, at least a couple of days, so we can look at it, so that we can, so the board can have a continuing viewpoint about what's going on with those. Thanks.
Thank you, Ms. Kerr.
Madam Chair, this is Leslie Johnstone. I'm actually expanding this to have an external review to make sure that the monies are being properly accounted for.
Are there any other questions from even our ex officio members? All right. There being none, then let's close the discussion on the enrollment statistics then. Okay. All right. All right. Next item on the agenda is the update on individual billing transition from Xerox over to the exchange carriers. And who's going to lead that discussion? Mr. Green?
Yes, I think I turned the microphone on. Can you hear me okay?
Yes, that sounds good. Thank you.
Okay, for the record, I'm Dan Green with Xerox State Healthcare. And there was a document that was posted to the website, I believe, within the last couple of hours. And I'm going to be going through that document now, more or less slide by slide, but obviously responding to any questions that we have. So the first thing is actually on the very first page I wanted to address. You'll see that underneath the title that there is a dot or a dash draft next to the first page. And I just wanted to underscore that I don't want to send the wrong message that this is incomplete or somehow not responsive to the board's request. I'm hopeful that the level of detail, the milestones, and the framework does address that. What I also wanted to do is emphasize that there's continued vetting that needs to occur. I'm pleased with the way that the working sessions have gone, but by no means does it represent the end of those discussions. And we do have very specific milestones leading up to a transition point in this particular discussion. But wanted to emphasize that the draft is only there because we recognize that every carrier has not weighed in, every element of Xerox has not weighed in, and every element of the exchange has not weighed in, though I feel like we've got a deliberate path and a deliberate set of milestones. So wanted to address that one first. I do hope to walk through the progress to date and then also to, excuse me, I'm getting more in front of the microphone. Wanted to walk through the progress to date as well as to outline those milestones. That was the deliberate board request. If you advance forward in your fan of detail, the last page of the PowerPoint, or last page of the PDF actually includes a pretty detailed milestone chart. I don't intend on walking through each individual one of those, though I am happy to address at the level of detail that there's any questions. But I'm actually on slide 3 right now, which is just a quick recap of the discussion around this topic that's occurred and going back to, I believe it was the board meeting on March 20th with some public comment and then extensive public comment as well as updates from Xerox and other parties up to today. So on slide 4, we talked about this, or I talked about this in the April 10th board meeting as well as in last week's board meeting, that the one set of feedback from all carriers at all points is that there are 3 things or 4 things, depending on how you slice it, that have to get done no matter what transition occurs, no matter when the transition occurs. And those are the items that are outlined here on page 4. We put some specific milestone and timeframes around those. We have had some discussions that are at varying levels of detail. But what I wanted to do was walk through here the specific milestones and these 4 items. I think it's been referenced at multiple points, the APTC exception population. And just to put a finer point on what that group is, it's a group of cases where at one point we have a data location where the advanced premium tax credit was supposed to be stored, but has been, in essence, lost in that particular data location and has required a day-for-day remediation of those cases. We're happy to say that about 1,000, and I can provide a more specific number, of those cases have been fixed in the underlying HIX portal structures and are now in the process of the number 2 item, which is the reconciliation of the EDI 834 and the 820. So as Mr. Remp had indicated, there are day-for-day variances that we are still working on, including the last couple of days where EDI files have not been generated. I do have an update on that particular topic that ACH transfers have actually been initiated within the last couple hours for the last 5 days of ACH. Or ACH, what I mean by that is cash to the carriers through the protocol automated clearinghouse. But the process that's referenced here in step 1 and 2 on this roadmap at the bottom of the slide indicates that process is going to carry us through the end of June, early part of July, meaning that as we fix individual cases and make sure the appropriate values are in the appropriate data locations, there's a subsequent go back, if you will, or true up with that particular consumer account where we go month for month, day for day, payment for payment to verify that particular account has been treated appropriately under the rules of APTC as well as invoice and delinquency. The third element here is we have had some discussions, again, as Mr. Remp noted, in and around the delinquency process. I refer to it in this presentation as a catch-up, meaning that the initial set of milestones for delinquencies, some of those milestones have passed, meaning that communication from the exchange or specifically from Xerox around delinquency will be going out in the next week to week and a half. We're actually in process of isolating that population and plan to share it with the carriers and the exchange before the actual transmission of any communication. But again, we expect that process to carry us through essentially the latter part of June. When I say carry us through, I mean that would be the completion of a cycle of identification of the appropriate consumers, notification, and then for non-payment termination, we would actually affect the termination through the EDI process. And the last piece of it, as far as a dependency for any transition, is stability in and around the EDI testing cycle. So EDI testing cycle I'm referring to here is around qualifying life events or QLEs on project, but in essence, completion of those activities on a transaction for transaction as well as a volume test. That schedule carries us out through about the middle part of June, or actually I believe it's the first week of June. So I spent a little bit more time on this particular chart, one, because there's been a request from carriers, the exchange, and the board for a little more granularity around when these efforts will conclude, and also because universal feedback from all the carriers that these have to be done prior to any transition, and they have to be done as soon as is feasible. So these mark the milestones that we're tracking to along those lines. So the next slide here, it's slide 5. Again, just to reorient to the April 10th discussion, as well as confirmed by conversations over the last couple of weeks, is that any solution and any timeline continues with Xerox or Exchange accountability for the eligibility and enrollment. So at a project level, that essentially means the interactions with the federal hub and determining the appropriate values for public subsidies or Medicaid, and all the way through to the EDI 834. So confirming that somebody has made plan selections and that we're at the point of communicating to the carriers for those plan selections and enforce enrollments. We know that there will need to be a data migration, that we have data, underlying financial data in our what we call Great Plains, but it's an element of the SSHIX solution where we will have to segregate, separate, and then transfer that financial data to carriers for any of the folks that are in force at the point of that transition. And we do know that there'll need to be some coordinated and outreach. We know that there's some consumers now who are receiving one bill for up to 4, I believe is the highest count that I have, for different carriers within the same household. So that would result in additional bills and coordination and communication in advance so that there's as little confusion as is possible to mitigate. So the next slide is slide 6 that talks about essentially 3 options that have been evaluated and discussed. I can say to jump forward that the option 2 or item number 2 here is what's reflected in the roadmap milestones that are in the next couple of slides, as well as the consolidated roadmap at the end of the presentation. But let me go back and say that there has been a specific request before the board for the potential of a pilot, and I believe it was originally mentioned in the Association of Health Plans update as early as May 1 or after the special enrollment period. I reported in the last April 10th discussion that there was a conversation in advance of the board meeting where the question was asked by the exchange regarding any carrier who wanted to be a pilot, and there was not a direct response to that. I can say, however, that in the conversations over the last month, there have been carriers that have volunteered and requested to be a pilot or requested to adopt this process earlier. Or as soon as is feasible, up to and including July 1. So to be clear about the April 10th versus the now update. At the same time, as part of that evaluation with the working level teams, that there's a level of complexity in that process. And in essence, a pilot assumes some degree of production-like operations with one organization, but not all. However, as part of that evaluation, we know that we would have to do decidedly non-production-like operations, up to and including segregating billing data for the families that have multiple carriers. That would, in essence, be suppression of data and a sort of retranslation of data to one carrier and not to others. And it has the potential to affect everything from delinquency proceedings and different rules associated with delinquency. So it presents likely not insurmountable challenges technically, but certainly with the timeline and the direction for open enrollment, it presents some pretty significant risks and challenges. Then to flip over to the third item is there was some discussion also initially requested in the Association of Health Plans for potentially a transition as late as March of 2015. Much of the feedback that I've received from the carrier community is that that has a potential to be very confusing to consumers, including those that would go through the calendar year 2015 open enrollment, meaning a bill for a new policy from Xerox and then the next bill from a different organization. And that's kind of what brings us to the second layer, which is I want to be very clear and pick and choose my words carefully with regard to a draft. I cannot say I've taken a poll or a vote across the carriers to say that this is exactly how it should roll out. That being said, have received the feedback that the open enrollment period represents a point at which, one, we could do all carriers at the same time, and two, that it could initiate a payment relationship for open enrollment that starts with the carrier and could conclude the payment relationship at the end of the plan year from a Xerox perspective. And then it's actually built up through what I believe is, the milestones will change in terms of interim day to day, but I think it lays out a process that I believe can be managed successfully in parallel to the open enrollment readiness for the November 15th timeframe. So I want to spend a little bit of time walking through some of those tasks, but as I said, in the interest of time, I probably won't walk through every element of the roadmap unless there's a question. So slide 7. This is really a set of milestones that aren't directly related to Xerox. It's just put in context of the certification of plans and rates. And also just to do the due diligence in terms of requests that we have fielded at Xerox, that there are some organizations who have indicated that different compensatory elements may force them to not participate on the exchange as a result of some of this. Some of the activity around aggregate billing, but that is not a series of conversations about either participation in or rates for the exchange that we've delved into those working sessions. We know that that's a dialogue that occurs with the exchange and the carrier and DOI and other parties. So the next two slides here, slide 8 and slide 9, are what I characterize as the before open enrollment and the during and after open enrollment. So on slide 8, this is the build-up to what would be a transition process, meaning that it's a deliberate life cycle. It takes representatives, and I think first and foremost in that one bar there, let me explain my color key. I'm a fan of color. So the purple and the blue actually mean something in each of these bars, meaning it's a shared activity. So you'll see that the purple bar is thicker, but nonetheless, the blue bar indicates that there'll need to be active participation from each of the organizations to make the transition successful. So what you see there in the first part of it is we'd be looking for the dedication of a point of contact for each of the organizations. And the nearest term milestone would be what we happen to call a concept of operations. Meaning, I kind of think of it at a practical level as a stacking hands around a document that says this is how it's going to work, and a detailed schedule associated with that, where the Project Management Institute and different life cycle elements would take over for the actual detailed schedule, but that we would be in position to stack hands and say, yes, this is how it's going to work. So that would roll through, and then we spend a little bit more time on slide 9, which actually has some activities outlined there that would be more around communication with the external exchange partners. So you'll see at the very top of it is a coordination and communication plan, and that would be interaction with, say, how are we going to reach out, or when do we reach out, or do we reach out to particular consumers to help explain this particular transition. And what you'll see here is a buildup of activity without going through each one that addresses renewal notices, that addresses the last Xerox invoice and the first carrier invoice for activity. And it's all based around the notion that for any new calendar year 2015 open enrollment, that would be the point at which the carrier would own the payment relationship. So a congratulations, and here's the payment you need to make to affect your enrollment. And that there would be a transition in the latter part of October through December that would close out the calendar year 2014 consumer relationship with a bill for the December coverage month from Xerox. So the first bill for calendar year 2015, either as an open enrollment or a renewal, would be from the carrier community. And that's the short as far as a build-up, and there's obviously going to be some activity that would be associated more with the day-to-day migration of data. There will be a need for parallel operations. We will get payments that should go to the carrier. The carrier will receive payments that should be reflected in our system for the last month. So there'll need to be a coordinated effort, and that will continue through the open enrollment period. And we'd set up provisions to make sure that it's something as tactical as a misdirected payment to the wrong lockbox gets appropriately routed. So we'd set up detailed procedures for that transition. So again, I realize I'm throwing a lot of data at this group, so certainly take questions, but what's on target for me in terms of an immediate next step would be, one, is direction from the board in terms of timeline or the framework or the milestones. And two is assuming that there's a continued go forward, that we would be able to sort of get a Tiger team or a SWAT team, or I'm not sure what the appropriate language is, but a point of contact from each of the organizations so that we can stack hands around that concept of operations and come back to the board with at a level of granularity that the board requests or direction to project staff. So I've done all the talking so far. So I recognize, again, I've thrown a lot of data, so I'm very open to questions or after the meeting types of discussions.
Thank you, Mr. Green. Let me open it up for questions. Dr. Jamison?
Going back to sort of early part of your report, I'm excited to hear that you had more than one carrier approach you and volunteer to be in the pilot. I was just wondering, who will there just be one, and or will all that are interested in piloting be involved? And if there's just one, how will that be determined which one?
So Dan Green, for the record, I believe as part of this set of analysis is that it wouldn't be a recommendation to have one carrier move through the transition before other carriers, meaning that it's advisable from a risk perspective that all carriers do the transition at once. And primary value of that is that it's a technical challenge and a schedule challenge and a pretty significant risk to segregate the data in the current operation. Essentially, it means if for one carrier we would have to suppress or translate data, and for another carrier it would go through our quote normal process. And as a result, you would be sending, it'd be a communication challenge with the consumer. So part of what this second option lays out here is that all carriers would make the transition at the same time.
Okay, so I'm sorry, this is Marie Curry. You want all carriers to make transition at the same time during open enrollment? If I hope that wasn't what I heard, and you're not going to have somebody on a pilot. Don't you think that's a little risky?
This is Dan Green, for the record. I think, frankly, there are risks on all the different options. So I certainly wouldn't say that any one is safe. Just to be blunt. That being said, in advance of the open enrollment, I think the timeline is what gives us the opportunity to do those types of integrated testing and the types of coordinated outreach that I think are going to be necessary to reduce the confusion. And yes, that for number 2, that does indicate that the first invoice from a carrier for an open enrollee would occur at the initiation of open enrollment. So it could be as early as November 15 for the first consumer who goes through open enrollment.
Mr. Green, if I might, where you talk about the carrier issuing the first billing to the enrollee in November, or possibly doing it, that is for the January 2015 premium. Is that not correct?
Yes, Dan Green, that is correct. That it would be, a practical scenario would be Dan Green signs up with Anthem on November 15th, and that data would transfer to Anthem, and Anthem would send me the first bill.
Okay, so the goal is that all premiums for 2015 will be issued by the carriers.
Dan Green, yes, all premiums for 2015 would be issued by the carriers.
Thank you. Ms. Johnstone?
Thank you, Leslie Johnstone. I have a couple of questions. The first is, approximately what percentage of our family units selected plans from different carriers?
So this is Dan Green. I can get you the specifics, but it's about 30% of the consumers that have affiliations with more than one carrier.
Okay, thank you. That's a lot more than I would have expected. Go ahead.
Stand for the record that I'm getting a lot of feedback here. Are folks hearing that? So this is Dan again for the record.
Marie, if you do not have your phone muted, we might be getting some feedback. So would you double check that, please?
You're on mute.
Thank you.
And also, if everyone can make sure their mics are turned off, that might help as well.
This is Dan Green again for the record. The preponderance of the split families, if you will, it's not the right term. The preponderance of families that have multiple carriers is based primarily about a medical to dental split. So there are a fewer percentage, and I can get the exact number, that are what I would characterize as medical to medical. So an HPN and a co-op medical plan within the same family, it typically falls into the category of a medical and a dental being with different carriers.
All right, thank you. My second question is, because the EDI process now for enrollment is not working, what is the last date that the carriers would have to sign on to this process? Because I'm sure that most of them would want to have the EDI process working for enrollment correctly before they assume this responsibility.
Yes, Dan Green for the record. That is a feedback point that we've received early and often from every carrier. Part of what we tried to characterize on, I believe it's, I get lost, it's the first slide 4, sorry, is that from a stabilizing the EDI process and associated cleanup of some of the majority of the cases that have created the difficulties, we're targeting for the late June, early July period. And so that would be across all carriers and would address the data anomalies and the difficulties that make the EDI transition or transmissions problematic, that by the early part of July, those milestones are captured. And that would be the point at which, from a baseline across the carrier feedback points, that we'd be in a position to reach, I hesitate to say the day of confidence. I don't want to parrot the words of the association, but that would be the point at which we feel comfortable that the processes are ironed out.
Thank you. I think a specific date for that decision to be made would be very important instead of late June, early July. But thank you.
Madam Chair, Lynn Atkins. So back on slide 4, so the EDI reconciliation, that's the reconciliation with getting the data and the payments from the exchange to the carriers. Is that right?
Yes, Dan Green for the record. The 834 transmits the membership information, and the 820 transmits the financial information from Xerox to the carriers.
Right. And then item 3 is the catch up for existing delinquencies, and those are folks who haven't paid their monthly premium. Is that what you're calling a delinquency?
Yes, I get this, Dan Green for the record. We're getting our feedback again here. Okay. So again, Dan Green for the record. The more precise term is delinquency and termination for non-payment. So when I refer to delinquencies and catch-up, I'm referring to non-payment of premiums. Yes.
Push the difference. So how is it that you're able to determine whether it's funds that you have not, and I mean Xerox has not transferred to the carriers, where an individual has continually paid, but that hasn't been transferred, or a person who hasn't paid? How are you distinguishing those two, and how are you figuring that out?
So Dan Green for the record. I want to make sure I'm being clear about and I apologize, folks, I'm getting a lot of feedback here. I don't know. Okay, I'll plow through it. The termination for non-payment that I'm referring to here means that if we take an example, a case that effectuated on January 1st that is recorded with APTC, the regulations and the rules would indicate that non-payment for that particular case is evaluated on April 25th. So non-payment for the February coverage month is calculated or determined as of April 25th. So at that point, the payment records we have would work back, if you will, to the February 25th grace period, and that would be the determination of a delinquency and a potential termination for non-payment.
And how do you differentiate that person from the person who has been paying for 4 months but that information has not, and financial and the payment has not been transferred to the carrier? How are you differentiating between those two groups of people?
Right. It sounds a bit like a spaceship on this end. Dean Green, for the record, the step in the process that, I'm trying to avoid getting into too much of the file exchange, but the step in the process in our Great Plains system, you getting feedback there?
Help. Everybody just check and make sure they're. Can we switch out a microphone for you? See if that might work.
Is that better?
I think you still have feedback going. I think we can hear it here. Do you still have it going?
We do.
Okay. Why don't we see if staff can switch you to a different microphone? Turn your microphone off, Mr. Green. Let's see if that.
Can you hear me now?
Madam Chair, we're going to disconnect Ms. Kerr and then allow her to reconnect and see if that solves the problem. It's usually the telephone.
Okay.
Okay,
we'll
I'll
go
do
ahead
that.
and try that. We're trying a couple other things here too.
See, it's gone now. No, it's not. I'm a liar.
Welcome to AT&T's teleconference service. Please enter your access code, followed by the pound sign. To join the conference as the host, press star. Please enter your host password. There are 2 participants on the call, including you. You're joining your conference as the host. For a menu of available commands, press star pound.
Marie Kerr, I'm back.
Mr. Green, is it still whistling?
It's not. Well, now it is, but I can just keep talking through it if you folks can hear it. So, folks down in Henderson, can you hear us now?
Now, we're suggesting that maybe you take the audio visual down and bring it back up and see if that gets rid of it. I mean, I know it's piercing. Okay, we're going to take audio visual down, bring it back up, so give us a few minutes here. Okay. Can you hear me?
We can.
Okay, and is the feedback gone?
It is gone here. Yes. Sorry to.
Oh, good. All right. We know the cure, at least the cure this time. Yeah.
So,
Madam Chair, we're going to reconnect Ms.
right.
Kerr real fast.
Okay, and if you'll give us just a minute, we've had a couple people leave the room. I'll start the meeting in just a minute.
Welcome to AT&T's teleconference service. Please enter your access. To join the conference, please enter your... There are 2 participants on the call, including you. You're joining your conference as the host. For a menu of available commands, press *#.
Ms. Kerr, are you on the line again?
I'm on the line, and you're on mute unless I'm talking.
Perfect, thank you. So whenever you're ready, Madam Chair, we are ready here in Carson City.
Okay, why don't we get started again? All right, let's refresh everyone's memory on what question was being addressed.
My current question is, how is it that you are differentiating between the folks who have paid and that information and the money has not been transferred over to the carriers, and those folks who have not paid and are delinquent at a certain time period?
So, Dean Green, for the record, where I was starting to go is there's a multi-step process, which is the recordation of the payment in our Great Plains system. As we get that payment, literally a check or IVR or the different channels, as we get that payment, it's posted to that consumer's account. The next step, however, is the generation of the EDI 820 and the associated cash that goes to each carrier. So from a delinquency process, we can say that the payments that we have received have or have not posted to a particular consumer account in Great Plains, meaning that the transmission of the actual data and the cash to the carrier is a third step in the process. That's not to say we don't need to reconcile that process. It is to say, however, all of the payments that we have received are posted to the account in Great Plains. So that's where our selection criteria sits, to say that Dan Green has or has not paid $100 to the Nevada Health Link.
Madam Chair, this is Leslie Johnstone. It seems that we're hearing payments have been turned into Xerox and have not been posted to their account, even before the EDI process, though. So I think to drill down on Ms. Setkin's question, the payment's been made, Xerox hasn't posted it yet.
Yes, thank you. And I guess I think we've been asking, at least since February, how many of those accounts are in that status, and also sharing that list with exchange staff so they can resolve those issues. So why is it that information is not being able to be generated to us? Because if it can't be generated to us, I'm assuming there's no way that Xerox can fix it. So why is it taking, what are we, 3 months in now, asking for the same information? And this needs to be completed and up to date before any of the transfer of the payments, before the carriers can start billing. before next open enrollment. So this is something we've been asking for since last February, when we first heard it became an issue, and we don't know if there are 5 people or 500 people, and staff needs to know who they are so they can resolve these particular issues. So why is it that we have not gotten this information?
Dan Green, for the record, unfortunately I can't speak to why in the past. I can say that I do have a set of queries that are being reviewed quite literally as we speak with the payment history for individuals in the Great Plains system. And that will be the foundation for this delinquency process. And the first step in that is sharing that data with the exchange and with each carrier that we have record of that consumer.
And when's that going to happen? The sharing of the information?
As quick as I can do. I literally have the data as we speak. My target is to make sure that's in the hands of each carrier by Monday so that it can verify that we've done the appropriate selects. I can say that I don't know if they're representatives of HPN on the line, that we did pull, in essence, a pilot version or a version of the payment history for all of their consumers. It was, I believe it was last Friday or it was this Monday. Was able to provide it to them, so we proofed the process, and I now have the data for the other carriers and just need to segregate the other carriers.
So how many people are on this list?
I don't know at this particular point. I can answer that when I get back to my machine.
Jan, this is Marie. I'm sorry.
Can you give us is it less than 100? Is it more than 100? Is it less than 10? Is it more than 10? There's got to be, you've got to know some information. Again, we've been asking for this information since February. So where, is it less than 100 or more than 100?
This is Dan Green for the record. It is more than 100. The data query I'm speaking of is associated with every consumer that has an in-force policy for which we have an account in Great Plains. And so on a monthly basis, I believe the total number of invoices that we generated for this upcoming coverage month is about 30 or 31,000. I don't want to provide figures in a way that I can't specifically vouch for. As I mentioned, I have the queries on my desktop and would be happy to provide those to exchange staff right after this meeting.
So I think you either you are not understanding what the issue is or what the question is at the moment. The group of people who have been paying, have made payments, and have not received any information about who their carrier is or have received their insurance card. That's who we're talking about. We keep hearing that there are many people in that situation. We have been asking since February, how many people fall within this group? Again, those names are not to be made public. Those names are not to be given to the board. Staff needs to know, here's the list of names of people that we have received money for, but the money is in cyberspace and has not been transferred to a carrier. So these people do not have insurance coverage, but they've been paying for it. We've been asking for this information since February. If that information and if those details have not been reconciled prior to all of the payment processes changing prior to open enrollment, it's obviously not going to work. But again, this is information we've been asking for since February. Why don't we have it? And I guess I would ask that staff has this information no later than Friday. So can you shed any more light on that?
This is Dan Green for the record. I understand the request and taken notes. I understand the request for this information no later than Friday.
Dan, this is Marie Kerr. The question is, do you have the information? The first question, the specific piece of information just requested. And number two, if you have the information, why doesn't our staff have it? And number three is get it to them as soon as possible, no later than Friday. Okay? So if you can answer the first two questions, and I think we've heard a promise on the third.
So Dan Green for the record, the questions here is, do we have the data? Yes, I believe that we have the data. Second question is, why doesn't staff have that data? I can't speak to the historical piece. What I can tell you is that I'm actively in process of getting that data to the exchange staff. And I understand the request third, but we have an answer to you by the end of the day tomorrow.
Okay.
Ms. Johnstone?
Thank you. Leslie Johnstone. What is confidence level that all payments that have been received have been recorded in Great Plains?
So this is Dan Green for the record. I do have a confidence level that the payments that we've received are posted in Great Plains.
Not to be flip, but is it 80% confident, 99% confident?
So Dan Green for the record. I have a 99% confidence. I've worked in this particular area that all the payments that we have received are posted to the appropriate account.
Chairwoman. I know one of the reasons that our radar went up 6 to 8 weeks ago was we had heard a number, and I am sorry that I can't recall that number now, whether it was $100,000 or $300,000, but that there was a certain amount of money that was sitting in the bank that was specifically received, and it was not applied to the specific carrier in which it was destined to. The connect was missing. So another way for me to get my arms around the magnitude of this problem is, in the past, you guys did tell us how much money that was, and how much is that now, and has it reduced itself, that amount of money? I think it might have been 100,000. I don't remember if any of you remember.
This is Dan Green for the record. I don't have that data. Let me just make sure I have understood the request, which is it's a normal part of our process that payments will fall into a suspense status, meaning that there's insufficient data on the check or other sort of normal cyclical reasons why a payment would actually be sitting in a suspense status before being applied to a particular consumer. I don't have that count. I'm happy to provide that count of our standing suspense list, if you will. Is that what you're referring to, or are you referring to a different bucket of money?
I think that sounds closest to what I am referring to. Thank you.
Let me ask you one other question, Mr. Green. In most of this conversation, you're referring to Great Plains, which I assume is your accounting and billing system. Do you have any monies received from enrollees that has not hit your accounting system?
This is Dan Green for the record. I just want to make sure I splice that down. On a day-to-day basis, we take the payment information and the cash from our particular entities as they're collecting it, be it IVR or the SSHIX portal or the lockbox. All of that cash is loaded into, in Great Plains, I apologize, I slip into project speak, but yes, that's our financial management component. That money and that data is posted into Great Plains and reconciled into the account. I don't believe, and I can certainly ask the right set of folks, that there's another spot where money is held before it's actually recognized in our Great Plains system.
If you might ask that question, if the response is yes, would you please give us the amount of those monies and how many enrollees that includes?
This is Dan for the record. Yes, I will.
Thank you.
Chairwoman, is it possible that that could be one of the reporting things we see from month to month, just to know how large that account is, particularly with regard to the number and the whole value of the cash, the number of people it involves?
I think staff will take notes on that and make sure that that's included. I guess we're talking more about the suspense account and a subsidiary suspense account. We've had a request earlier today that some of the carriers would like to make public comment during this discussion period. And so if we don't have any other questions from board members, I will invite carriers forward if they still want to have public comment at this point in time. If you'll please identify yourself for the record.
Good afternoon. My name is Tom Zumtbel, the CEO of Nevada Health Co-op. Madam Chair and Board, thank you very much for letting me come this afternoon, and thank you for all your work. It's I wanted to scream, "This is terrible," and I decided not to in the middle of the meeting. It's just so hard what we're all facing, and it's not only the payment. I mean, the whole process today, and what we're going through with Xerox and the challenge, but there's a lot of people that are being served, and we are making a lot of progress, and your work is greatly appreciated. I'm here as a representative of Nevada Health Co-op. I also have regular communication with the other carriers, and specific to this issue, the premium collection and payment management, and understand the strong interest just to do something different in any area that you could do something different and try to find some way that we could have more satisfaction for Nevadans and more satisfaction in the process. And so I appreciate that. Dan Green has had a tough role today because it's a hard, very complex area that he needs to explain. And realistically, when Dan came to us and talked to us, it was one of the first people from Xerox that I felt came pretty close to speaking a language that we could understand, and because it is so complex. But the board members, I thought you dialed in on the very right areas, and there's several of them. But we, Ms. Campbell, you'll remember in December, no, in October, when we first started the EDI process, and Xerox made a commitment to us that they were going to, that they were going to get our files to us at the latest by December 6th was the commitment that was made. And we do not have those files yet, right? I mean, get tested files to us, and we were going to be able to do that. So we're still doing all those files manual. We're still in the testing process. The commitment was that was going to be done by December 6th. We received contingency files. We started the process talking to them. We, being all the carriers, started the process talking to them about contingency files because we could tell it wasn't going to happen. They kept saying it was going to happen, and we said, at least get us some contingency files. We received those contingency files on December 28th, and so here we have to roll out ID cards. We have to do everything, all carriers, not just Nevada Co-op. We're all worried about meeting the needs of our consumers. We're already against the, we're up against the wall. Well, this is the same type of process again, and I just want you to think about that as you go through, because when Dan talks about either somewhere between June and July, the EDI process is finally finished, and at that stage, we're able to start to move forward as far as assuming the premium billing. I don't have any confidence that it's going to be done. And so how do we kind of get ready? And I was disappointed that they couldn't take the pilot approach, and I think that Dan is probably appropriate the way he describes the complexity of the pilot approach, but at least with a pilot, we could find out if something worked, and then we could all move into it. I don't know how we're going to get through the next enrollment period as it is. And so I understand we're all in a very hard spot. I was hoping the pilot would be a good option. I think that the carriers are just absolutely committed to doing what we need to do. I've been so impressed with all the carriers, how they work together and keep bringing resources. But the other concern, and I know you're in a hard spot. I wish I had it. I don't want to come up here and give problems and no solutions. But the other very valid concern, and I say it's valid, you'll have to decide. If Xerox starts to move resources towards the payment, the premium, the transitioning the premium over to us, all of a sudden they're going to move these other resources that are supposed to be doing the other things that are to get us set up for the open enrollment period. And I don't say that flippantly. I say that because that's the real result. This thing that was discussed by St. Mary's earlier in the meeting as the opening public comment was that these EDI records, they just all of a sudden stopped, right? We were getting stuff and the testing all of a sudden stopped. Well, it stopped because they had another problem, because there was too much of a variance between the 820 and the 834 file. And because of that variance, they had to move the resources over to the, to this, and then all of a sudden they're not doing. So I am very concerned if they move the resources over to the premium management to get in that, then all of a sudden what's going to stop? And I think that's very frightening for us. Okay, specific to the co-op, we didn't build our business model to collect premium. You know, we didn't. So we're going to have to go out and raise funds. There's two components to one that's buy a system. We don't have a system in place to collect these, so we'll have to raise funds. We haven't been able to figure out the exact amount. I think it's about, $200,000 or something like that. So raise money to collect the premium, and then ongoing, we're going to have to put staff on to manage that process. So that's costs that go into next year. All things that we'll have to deal with. That's a little bit of a curveball for us. The other carriers have those systems in place, so we'll have to work that through. Doable, but with this uncertainty of a June, July start, not really knowing when we're supposed to start, and then have it up and tested before the open enrollment period gives us great concern, frankly. So, but we're with you, and we can't tell you how much we appreciate what you're doing, and we see a lot of effort on everybody's part. So, but that's where our main concern is, will this happen in a time that allows us to be successful, and it's not the repeat of the EDI for December. So, thank you very much.
Thank you for your comments. I always appreciate that you're always very constructive in the comments, too. Thank you. Before you leave, I don't know if anyone might have a question for you. Okay. Thank you. Mr. Green? Okay. And then also, are there any carriers up north that wish to speak?
The answer is yes.
Okay.
Art Ram for the record, St. Mary's Health Plans. Just want to echo what Tom said. We are all committed to making this work, and we've been working hard at it, throwing lots of resources at it. Appreciate the work that Dan's doing. As Tom said, Dan's not in an easy spot. But if we, my concern is that if we push the pilot to when we're doing open enrollment, as was expressed earlier, we're going to have a challenge with open enrollment and getting the billing right. So in my thought, we need to do it earlier. The June, July timeframe might be a little bit early for us to all be ready, but we can't wait till November to do this. It's got to be somewhere in the middle there. So that's my comment. Thanks. Is there any questions or anything I can answer, Madam Chair?
I think there is one for you.
Yes, this is Leslie Johnstone. Could I get your reaction to the idea that I was trying to express earlier about a commitment from the carriers to move forward being contingent on getting the EDI files working correctly, the enrollment and eligibility file working correctly before a commitment is made by the carrier? Or is St. Mary's prepared to work on this, assuming that the EDI file will be in place by late June, early July, hopefully a specific date?
Well, Art Ramp, so before we can take on the billing, we have to have that reconciliation done. We have to have the 834 and the 820 clean. It will just further complicate the issue if we take over billing and we don't have good data that we're starting from. Now, I'll just leave it at that. Does that answer your question?
Well, it may not be a hard and fast answer that is appropriate. I was just wondering if we need to have this agendized again at the June meeting to decide once and for all on the go forward date based upon the EDI status at that point.
Any other questions? All right.
Thank you.
Mr. Green, let me ask you one question. If you would go to your PowerPoint and on page 4, and that page is the key dependencies and priorities. On the second line on the bar graph, where you say you'll complete the EDI 820s and 834 reconciliation by that June-July date, did you set that date, or did Xerox staff set that date?
Stan Green for the record. When I say I set the date, I mean I and we Xerox. So it's not just Dan Green, it's Xerox.
Okay, and this is based on your review of everything and the timelines that they've missed in the past. What type of confidence level do you have in them meeting that goal by, let's just pick July 1st?
This is Dan Green. Let me be clear. It's hard to sit here as the next Xerox representative and say, yes, I feel confident, but I feel confident. And it's a difficult position that at a personal level, you don't want to say, yes, it's going to happen if you don't believe it. And I believe it. And just for the record, on the July date there, it's actually on our integrated master schedule as I believe it's July 2nd, but I will confirm the specific date. These milestones were based upon an actual schedule. But does that answer your question?
It does, and I think, speaking for myself and the rest of the board, I think we all realize you're in a hard spot where you are, and we appreciate the way that you continue the discussion and dialogue with us. So thank you for doing that. If we sound a little skeptical, I think it's because we have history supporting that skepticism. So I think we have someone else here from Xerox that wanted to testify as well.
I just wanted to add one thing. This is Greg Vidiello for the record. To support what Dad is saying, we brought in additional resources through a third-party consulting firm that's focused on reconciliation processes and will be assigned to this, as well as bringing in additional temp staff to help go through the data reconciliation piece. So in total, approximately 10 additional resources to assist for that process.
Okay, and then please don't leave, but I want to address this to Mr. Green again. About
Madam Chair, you're cutting in and out.
All right. Mr. Green, can you address the co-op's concern of diverting resources to this reconciliation process when those resources should be used for open enrollment purposes?
This is Dan Green for the record. It's a legitimate concern. It's always a risk in terms of additional sets of activities. What I can say is that as the management team, we've talked about, as Mr. Vidiello said, we talked about bringing in some additional firms and some additional bodies. But as the board decides to move forward, this is treated as a dedicated project, and it'll be staffed as such.
And I concur with Mr. Green.
Before we close this agenda item, do we have any other questions or comments from board members?
Madam Chair, this is Todd Rich. Can I make a comment regarding
Yes,
Mr. Green's
please.
testimony?
Yes,
We've had
Mr.
the opportunity to talk to the carriers on numerous occasions. I think we understand their concerns. I've had an opportunity to listen to Mr. Green's testimony, hear the carriers in respect to if and when we're going to cut over billing at a certain date. I don't think there's a perfect answer, but I do think we need to keep in mind that maybe picking one date and moving all the carriers over might be the best way to approach it. I'm very concerned from a consumer perspective that if we have different time frames when premium is going to Xerox or going to the carriers, who's going to be able to understand all the differences Xerox has enough on their plate. They've got a lot of work to do. I really appreciate what the carriers have gone through. They've spent a lot of time and money on these workarounds, and I think we need to do everything we can to support them to ensure that they want to come back for 15. So I think picking one date, whether it's September 1st, well, whatever, and not having one carrier go one date and then another carrier and then having different dates, I think would be more helpful to Xerox's team that answers the phones and talks to consumers. And from the division's perspective, I think we'd be more comfortable with that approach. But again, I don't think there's a perfect answer, but I just wanted to get that on the record because I think the less we can give Xerox from a technology perspective and a operational perspective is better, so they can focus on the task at hand. Thank you.
Thank you, Mr. Rich. Any other comments? Ms. Johnstone?
Yes, this is Leslie Johnstone. I have come around to the idea that bringing up all or transitioning to all carriers at the same time, I now think that that's the best way to go based upon what I've learned since we brought this up 6 weeks ago. And I would just ask that we agendize this for the June board meeting so that we can get an update on the status of the EDI reconciliation. And then in the meantime, ask Xerox to work with the carriers as closely as possible to come up with a consolidated recommendation. We've got different opinions from different carriers about go live dates with this conversion or transition of the billing. And I appreciate that what St. Mary's Health Plan is representing, that having it be earlier than the start of open enrollment would probably help smooth out some of the workload on everyone's part. So I would ask that it be agendized for June, get an update on the EDI process, and also have the consolidated team come forward with the earliest possible date that collectively they think this could happen.
Thank you. Dr. Jameson?
I agree in the ideal world with all of what you said. I just am concerned that with the track record, we won't be following that timeline, and it may project 6 or 8 or 10 weeks into the open enrollment. And it might even indeed occur at open enrollment with multiple problems, which scares the heck out of me. And so I agree with your recommendation that we just stay right, is that right, gunshot on the stay really on top of this. Because if it's not really ready to roll out, I'd rather not roll it out. And I don't want to push it. I don't want to run into all the problems we had, IT problems we've had this open enrollment, as much as I'd love to get it going.
Did you want to make a comment?
Yes. This is Greg Vidiello again for the record. I agree. We are only interested in doing this and doing it right the first time. We've certainly have been down the road of processes, rushing to put new processes in. I think it needs to be methodical. Part of Dan's presentation today, he stated that we were going to go back. We have a third, another party who's in looking from a technical standpoint at our ability to do it, along with what has been come up in the meetings with the carriers, and part of why we need to come back to you is we want to go through and really vet that, and it's somebody outside of Xerox doing it that we work with to review that process, and the same type of process that we're following, how we'll get from here to open enrollment. So, sorry.
All right. Any other questions or comments before we close this agenda item? All right. I think staff knows what the board wants for on the next agenda. All right, thank you. Let's move along then to the budget. And is it Ms. Eaton?
Thank you. Carrie Eaton for the record. Last week, the board requested that staff provide monthly budget reports so that the board has a better understanding of the finances when making critical decisions. This report will provide the board with an overview of the budget and projections of the exchange for the current fiscal year. This fiscal year, the exchange is primarily funded through federal grants. NRS 695I also allows the exchange to receive an advance from the State General Fund that will be reverted at the close of the fiscal year. The per member per month fees that the exchange has been collecting since January have only been used to fund the Navigator program during this fiscal year, and the remaining revenue will be used to build a reserve that will sustain the exchange through the next fiscal year. The tables on page 2 of the report outline the current, pending, and projected revenue and expenditures through the end of the fiscal year, with approximately 68% of the available budget expended and projected. The exchange has recently begun the budget building process for the 2016 through 2017 biennium with the adoption of the exchange per member per month fees and the board approved expenditure requirements for the exchange enrollment facilitator entities and marketing advertising for 2015. The process can now move forward to project enrollment and revenue to meet expected obligations. That process will accumulate in an agency request to the Nevada Department of Administration's Budget Office, the Legislative Council Bureau's Fiscal Division, and finally as the Governor's recommended budget to the 78th Legislative Session that begins next February 2015. Once the budget is finalized as agency request, exchange staff will update the finances and sustainability plan with recommendations and bring it back to the board for approval. Thank you.
This is Marie Kerr. Can I ask a question?
Sure, Ms. Kerr.
Carrie, does the budget include any projections for the additional staff for enhancements as suggested by Deloitte? I'm particularly interested in at least one project manager.
Carrie Eaton for the record. Those funds will be requested through a 6th Level 1 grant application that we will be submitting next week.
Okay.
This is Damon Haycock for the record. Ms. Kerr, the projections don't include those numbers because these projections go through the end of fiscal year 2014, which ends, of course, June 30th. And the expected award date for the 6th Level 1 grant dips into the next fiscal year. So if those funds are awarded, this, of course, will reflect that in our 2015, or excuse me, state fiscal year 2015 go forward tables in this type of report. So if that is awarded, you will see those in those projections and you'll be able to follow them throughout the process.
Okay.
For the record, Shauna DeRose, just a couple more things on that. So understanding there's two parts to the project management function that Deloitte pointed out in their contract. One is, you all know that George McNeil, who was our IT officer, left in February. One of the things they asked was we need to replace that person. We have had a current recruitment going to do that. We have not gotten to the point yet where we can, much like the board for the executive director, we're still searching for the best people to be able to do some interviews. The IT officer, way back when, was the vision for that position was to be the project manager on this project. It's part of the job description. Now, in addition to that person, who also serves as our information security officer for the exchange, in addition to that, we need project management staff. The 12 staff that we currently have, there are 13 positions, can't do this. We have requested additional funds in a redirect in a current budget that we have. We will request additional funds in our next grant application to take current funds that we have and hire some, I want to say temporary staff through the state MSA contract. These are defined IT positions that we already have a contract with the state that we can bring these people in. As soon as we have a direction from the board on where we're going, we will be able to bring in a team to help us reach those goals that are set by the board. So I just wanted to point out that we have two different kind of things going on. We have the team of the MSA contractors that we want to bring in, and then we are currently looking for that IT officer position, and that recruitment is ongoing. And that person, we are hoping will perform the duties of the project manager.
Thank you, Mr. Bruce. Any other questions? Ms. Johnstone.
Thank you. Leslie Johnstone. Shauna, is the job description for the IT officer clear that it is to include the skills of a project manager?
For the record, Shauna Drews. Yes, I believe it's very clear. The actual designation of as a project manager is a requirement of the position.
Okay.
So I think we were very clear in what we were looking for and what we felt we needed to go forward and make this success. Okay, success.
And it would be my suggestion as one board member that you not wait on getting the MSA project management assistant, because we clearly need it now, and we don't have to wait for a potential change.
And that is why we had already requested the redirect of funds from our previous grant, and as soon as we have that from our federal partners, we can go forward with that. We just have to wait for that
Okay.
step.
I thought I heard you say that you were waiting for a decision from the board.
Decision from the feds to give us the approval to go forward with hiring, and then we will hire, and the board can tell us exactly which direction to go. I think it's all going to coincide, really, that once we get approval from the one, we're going to know the other.
Well, I think there's plenty of work to do without any additional board direction.
Yes.
My other question is, what assumptions went into the projected expenditure for the BOSS system? We've got $9.4 million here.
Damon, you want to take that, or you want me to take it?
I'll play cowboy on this one. Damon Haycock for the record. So the $9 million assumptions, the basis for that figure was on the expectation that we would pay Xerox for the per member per month fees as per our contract, dating all the way back to January. So all of those enrollments that have been effectuated and those folks that have been enrolled, we have been collecting fees, and we have not paid Xerox yet 1 cent of the per member per month fees per their maintenance and operations section of their contract. Additionally, there are the finality of the design and implementation of the DD&I funds that make up approximately $8 million of that line item, and that, of course, is still pending. And so we wanted to ensure that we showed everything that was capable of going against this budget within the time frame. And if the decision is made to satisfy that, if the deliverables have been approved and the funding has been requested and approved, then those funds will be provided to Xerox in accordance with our current state payment system. That doesn't necessarily mean that will happen by June 30th, so we wanted to at least show that there was a possibility to be 100% transparent.
Thank you. I didn't get a chance to read the report, but if it doesn't say it, I think we ought to go on record that $8 million for the deliverables is clearly pending the acceptance of the deliverables in working order.
The report does not state that, Ms. Johnstone, and I would also like to take a moment to ask if and when you do happen to take a look at this report and any of the other board members, if there's something that you would like to see different, we are more than amenable to making changes and to provide it in a format that answers more questions than causes.
Any other questions or comments on the budget? All right. I know we had agenda item number 9 for additional agenda items, but since the meeting's gone through, is there anything else that board members would like to add? You know, I would make a request of staff on this, and it's certainly not a criticism, because I know you guys are working 24/7 on this, but when these reports get posted the same day as the meeting, it makes it really difficult for the board members to really have ample time to read it. So I would like to have a goal set that these be posted. You know, we're talking about our regular Thursday meeting, that these things be posted no later than the close of business on Monday. You know, and if you're not ready then, maybe we ought to just kick it to the next meeting. But I think board members, particularly when we're going through as much as we are right now, we need to give board members at least 2 full days to review everything.
Madam Chair, Lynn Atkins, I don't know if this, my consumer assistance, the consumer assistance subcommittee meeting, I think we've set our next one for middle or end of June. So if there's anything that the board wants the consumer assistance committee to look at or have discussions about or work on, you know, let us know. So I don't know if maybe that might be an agenda item for the next board meeting, which is to give direction to the consumer assistance subcommittee if there's anything in particular. I think we've been doing some good work, but if there's anything particular that the board wants us to do, that'd be great.
And we brought this up last meeting, but I think we do need to circle back around with the budget for the next year based upon the assessment that we settled on last meeting, which was lower than what would support everything we asked for.
For the record, Lou Silla, I'm a broker here in Las Vegas. Just really a question that, actually a two-part question that relates to something Mr. Green said about cancellation notices going out. And if this information already exists, I apologize for duplicating it. I'm not trying to keep you here any longer. But once those notices go out, there's going to be this influx of people that are going to want to make payments. So the question is, if they want to make a payment, do they have to go back to the original date that the policy was canceled, so pay back 2 or 3 months, which I can tell you right now is not going to happen? Or can they pay currently and move the policy forward? Or is that a qualifying event to do a new application?
So for the record, Shauna DeRose, so I want to make sure I understand. So you're saying once the policy is not paid and is terminated, can they go back in and reinstate without going all the way back and paying all the months that they missed?
That was part of the question.
Can they start up in July or start up
Yeah,
whenever?
I mean, what I understood from Mr. Green was, if your policy started, let's say in January, and you made your January payment, but not your February payment, I guess I've not had anyone come up to me and say, I got a cancellation notice, so I guess these notices have not gone out. So at June, they're going to start going out, saying your policy was canceled effective March 1st, which I have to be honest with you, I'm not an insurance expert, but it just seems a little odd to do it that way. But nonetheless, if that's the rules. So now they come up to me and they say, okay, yeah, you know, and they tell me all the stories why they don't have any money, and I want to bring my policy current. So my question is, can they just, like in car insurance or house insurance, make up, you know, June 1st and move forward? Or they're just out of luck?
They would be, I don't want to use the term out of luck. They would have to wait until the next open enrollment period to then come back in and, or have they could go get married or have a baby or go through one of those.
And then they can get their insurance back?
Yeah, or go through one of those events. Or they could purchase off of the exchange.
Right.
Absolutely. They always have that opportunity to purchase off of the exchange. And I'm certain Todd Rich is up north and he could talk to that if you would like him to. They just could not come back in to the exchange at that point and say pick up in July again.
Okay.
And the point that Dan was trying to make earlier is that there are different rules for people with APTC versus people without APTC. There are different those periods, 90 days versus 60 days versus 30 days. So I think that's what he was talking about is people with APTC, the 90-day period. So But no, a person could not just say, I want to just start again in July 1.
Okay, and then the last question is when they come up to me and say, I made my payment, I mailed it in, because what happens is now, as of May 16th, if you go online, you're going to get an enrollment expiration notice, so you can't pay it online, you can't pay it by phone. So when you call Nevada HealthLink customer service, you get told you can either mail it in or have your bank do it through your card account. And a lot of people, especially in the neighborhood that I'm in, they mail it in. So now, and since they have to mail it to a P.O. box, even if they wanted to spend $5 extra, they have no way to send it as a registered mail to get a little receipt, but you can't do that to a P.O. box. So my question is, when they come in on June 10th and say to me, I sent my money in, what do I do? What do I do? Where do I direct them?
So I think there's a couple of parts to that answer. One is, I think this goes back to the request that the board made earlier to Mr. Vitiello about what are the payment issues that are happening right now and why can't people make those payments. We obviously understand that on the 16th of the month, you can no longer make your payment for the next month to start the June 1st. But I think there's some other underlying issues that the board previously in this meeting asked Greg to come back with. The second thing is, just so you know, absolutely a person can send a certified mail to the P.O. box, and we sign it and we send it back. So they absolutely get that little green card back in the mail, even though it goes to a P.O. box. Okay,
because I didn't think you could do that. Anyway, so I guess the next series of questions will be in the first week of June when we're getting barraged. And I'm sure Mr. Ramirez could probably write a book about this, but we'll see. We'll tune in and see how it goes. Thank you very much.
Yes.
I think this brings up a very important point that we need. I don't know if we've got any money left on the KPS3 contract or not, but this gets very complicated very quickly. And I think we need, as an exchange, to have some very easy to understand information on the website about what the delinquency rules are and what the remediation options are. And we need to be insert ourselves with the notifications that go out from Xerox to make sure that those notifications are clear and understandable. And we need to also communicate directly with the brokers and the navigators so that they know in easy to understand terms what the rules are. Because this is, you just can't have a conversation like this and think anybody's going to understand what the rules are. So I think we need to spend some time on it.
And one other thing on that, I have one other question, but the termination notice should also have a disclosure about the appeals process. It does, okay.
Do we have any other public comment here? And is there any public comment up in Carson City?
No, Madam Chair.
All right, thank you. Yeah, and press it hard. There.
Hey, brokers can do some things. What was just commented about is kind of like what my problem is, but my problem is since January, when people have called in and said, when do I have to get my money in? They've been told the 15th, so 15th of January makes February 1. If you don't get it in if you don't get it in by the 15th, then it goes to the next month. That's now been reversed. So I have people that have, yes, I've got people that paid their premium, tried to pay, got their app in, didn't get the money in until March, and they're telling them that they have to start paying effective February. And they're saying, that's your policy now. If you call the exchange and you ask them, that's what they'll tell you. Now, that wasn't what they told me 3 days ago.
I would love to have, for the record, Shauna Durst, I would love to have any HIX IDs or any cases that you have of that, and I will specifically look at those and get back to you.
Because I have a lady that is a type 1 diabetic. She paid her old policy for 3 months because they were told, till you get it in, doesn't count. If she didn't have diabetes, she could die. I was told for 6 weeks, we're working on it. 2 days ago, no, we're not going to do it. Sorry, you start February. And I've been asking for almost 2 months. That's one. And that is continually, I mean, there's a new policy. I don't know what's up there, but down on the level where they're talking on the phone, they said, not in by the 15th, goes to the next month.
And that is the policy.
It's not happening.
Madam Chair, if we could real quick, we have the gentleman state his name for the record so we can appropriately
Bob Kennedy,
apply it.
I'm sorry. Okay, that's not happening. Okay. The other problem is there seems to be different levels when you talk to people, and Xerox, I don't know if they don't seem to communicate to their own people. So we'll ask them a question, and depending on whether I'm talking to Marsha, Mary, Sam, or Fred, and which level they are, I got to call this manager or I got to call that manager, I get different answers. So now I'm telling a client, you don't have coverage. I had one client that was going to pay a COBRA premium because they were worried about the same thing. I got 3 different answers from the call center. Okay. The next thing is there's a thing called a qualifying life event. And I'll take the easiest one. I get terminated from my job. I don't have coverage where I work anymore. I need coverage. On April 15th, I had a client. I called in. We had problems with the computer. It took 6 times to put them in, but that's just the way it is. So, okay, we want coverage May 1. Yep, going to be May 1. Okay, just got for 3 hours on the phone this morning. Nope, going to be June 1. I got people, I mean, he's got a family. He's got 3 kids. And now I'm going to call him up and say, I'm really a stupid broker. I told you you're going to get coverage on May. You're not. It's going to be June. I hope you don't have a claim, because if you do, nobody's going to pay the claim. That's not you guys. I think you guys are wonderful. I don't know how you stand listening to all this abuse.
Why don't you get those HIX numbers to Mr. Roos and let staff follow up on those?
Then the last one is, when it was a qualifying life event, I asked, what do you need to do? You just put it in. So I put it in. 2 days ago, I got a 6-page life qualifying event fact finder. Oh, we can't decide until we see this form, which is missing information that you need, that any health insurance agent that does health would know those questions were there. So nobody asked brokers, hey, what should we be asking? Well, I don't know, maybe somebody did, but the form, and then nobody announced the form till yesterday. Hey, Bob, guess what? You have to fill out this form. Well, on the 15th of April, I didn't have to fill out a form. So now I'm telling a client, oh, you're supposed to have insurance. Now you don't have insurance because you didn't fill out a form that didn't even exist till 2 days ago. And it's 6 pages long. I'll get the stuff there, but that's our biggest problem. There was a report from the other people that said Xerox doesn't communicate with themselves. They don't. They make up a rule, and half the people we talk to don't know about the rule. And then all of a sudden, my client's stuck with this rule that nobody knew about. And then I look like, and other brokers look like, well, why should I trust Bob? He lied to me at worst, and at best, he's incompetent. He doesn't even know what to tell me. I'll get you all those things, but that's my biggest problem with Xerox, is they don't communicate with themselves, much less communicate with you. And we're talking about renewing them. If they don't even talk to themselves, how are you going to get the right answers if you want them to communicate with you? So I appreciate your time. Sorry for the excitement in my voice, but like I said, I spent 3 hours this morning playing with the call center. Thank you for your time. I really appreciate it. It's the other part that's driving me crazy. Thank you.
Thank you very much, but please get that information. One question based on all discussion. So if you go into the system on May 20th and you schedule your payment, you go in, obviously you schedule, will it take the payment, but your insurance starts July 1? So it will take the payment. It doesn't make you go back in later. It will take the payment, but your coverage starts July 1.
For the record, Shauna Drews, up until this discussion, I would have said yes. However, because of some of the issues, and earlier the board asked Mr. Vitiello to come back with a report on some of these issues that seem to be occurring, I don't want to make a definitive statement and be wrong here. So that is the way it's supposed to work. Let me get back to you with, and Greg is supposed to get back to us by close of business tomorrow with the issues, and I think that'll give us a better understanding of what's happening.
Thank you. So it should never tell you we won't payment. It will just be very clear about when your coverage starts.
I want to take everybody's money all the time.
All right, do we have any more public comment here in Henderson? Give it one more shot up in Carson City.
Doesn't appear so, Madam Chair.
All right. Thank you very much. Keep posted. We're going to try for a meeting May 23rd, and we'll probably post that early as soon as we get a time and a place on it. So thank you very much, everyone, and staff. Thank you so much for putting all the work together for us. Thank you.